Hi, everybody. This is Mark Monane, and we will be starting in just a moment. Okay, it's 5 o'clock. Thank you. And hello, everybody. I'm Mark Monane. I'm a physician and executive coach, and I want to welcome you to the October edition of our Doctor to Doctor group webinar. We are a group of healthcare doctors trained as coaches, and now we coach other healthcare doctors in the clinical and industry settings. We come to you every fourth Wednesday of the month with a topic in healthcare coaching. While we're waiting for other people to join, please type into the chat your name and where you are located. Remember on Zoom chat to select attendees and panelists so everyone can see your comments if you want something to share. If you want to send it only to us, choose the panelist only option. We have someone from Buffalo. And others people, please add as you come in. That would be great. Terrific. We all appreciate you being here. Let's go over the learning objectives for today. The learning objectives include the following: to understand how COVID has altered the healthcare leadership competencies required to be successful, to understand how emotional intelligence, a term that's used often in the real world and especially now in healthcare, emotional intelligence has become increasingly important in this scenario, especially for healthcare leaders, and understand key strategies for staff engagement and retention in the post-pandemic period and environment. So today, it's my pleasure to talk with Dr. David Dahl. Let me tell you a little bit about David. Dave is a board-certified anesthesiologist with over 30 years of clinical experience. Over the past 2 decades, he has had numerous administrative and executive roles, including hospital group chief medical officer roles in national hospital systems. In a role with the ACGME, he served as site visitor for the CLEAR program and helped to develop the current protocol that's being used now, focusing on assisting sponsoring institutions improve their GME programs in the areas of healthcare quality, patient safety, professionalism, well-being, and health disparities. Dave is an associate professor in the Department of Medicine at Georgetown University Medical Center, and he teaches the leadership and the executive masters in the clinical quality, safety, and leadership program. For our viewers today who stay until the end of the seminar, Dave has a terrific offer to share with you. With that, Dave, welcome to the show.
Thanks, Mark. It's great to be here and to be with our listeners.
Super. For today's format, Dave will start with some introductory comments. Then I'll follow up with some questions on my own. And lastly, we'll move to your questions from the chat. Remember, it's never too early to start typing questions using the chat icon at the bottom of the screen. I'm also going to include Dave's email and scheduling calendar for your reference, and we'll talk about this more later. So Dave, take it away.
All right, Mark, thank you again. Let's move to the next slide, please. As the pandemic began to unfold in 2020, I was involved in a lot of discussions, in part through the ACGME, about how healthcare leaders were ill-prepared to lead during a crisis like this pandemic and how COVID had really changed everything. And I began to hear stories about how the role of leaders, particularly physician leaders, were evolving very, very rapidly. Mark, you see, healthcare leaders are well trained to manage acute crises, things such as tornadoes or plane crashes, but planning and training for chronic crises that are going to last for months or even years, is outside of the current disaster management training and planning paradigm. And so early in 2020, I decided that I needed to document these changes in an attempt not only to understand the present, but also to communicate what needed to change to better prepare future leaders to lead during a chronic crisis. I found two wonderful like-minded collaborators, Karen Altacruz from the Marshfield Clinic Health System and Laura Nelson from the Prevea Health System. And together we decided to embark upon a qualitative research project to learn how the pandemic had altered leadership competencies required of physician executives. We completed structured interviews on 16 C-suite physician executives from across the United States. All the leaders that we interviewed were experienced executives with an average of 7.5 years experience in C-suite roles. Next slide, Mark. Next slide, please. There we go. As I ask, what we did is we asked each participant to identify the top 3 leadership competencies that they utilized in 4 distinct time periods: pre-pandemic, early in the pandemic, during the first phase of the first surge of the pandemic, and competencies that they anticipated would be required as we emerge from the pandemic. And the results of our study are highlighted on this slide, Mark.
So I'm looking at the slide, which is pretty robust. I'm looking at the competencies, and I see that communicating effectively really stands out. There's a checkbox in all of the 4 different stages. Not terribly surprising per se, but maybe you could comment some more on that, please.
Yeah, this was a really interesting competency, Mark. Thank you for pointing that out. As you correctly ascertained, effective communication is foundational for leaders, and it always has been, always will be. And so the fact that they identified it as a top competency in all 4 time periods really is not surprising. But what we found was interesting is that the competency itself actually changed during the course of the pandemic. It was interesting. As we spoke with these leaders, they all felt that additional communication training was essential for all leaders in the organization, no matter what the level of responsibility. And when I say that it changed over the course of the pandemic, what I mean is pre-pandemic, the leaders were used to communicating in person. They were used to communicating mainly with internal audiences. And as the pandemic moved forward, as we all know, we shifted from in-person to electronic communication. And many of these leaders found themselves communicating with many, many more external stakeholders than they were used to. Does that help?
Yeah, that was really good. That was really helpful too. And I'm looking at the other competencies, and they all sound great. And the question is that how do I know that if I'm doing a good job leading? How do I know if I'm using these competencies well?
Yeah, so again, how you know that you're doing a good job and how you assess your success really didn't change across the time periods that we evaluated. It has involved and always will involve, I believe, casting a vision and communicating it in such a way that those that you're leading willingly buy into that vision and support the vision. It's about being transparent with your stakeholders. It's about serving the needs of your customers and your staff.
That makes sense. I like the competencies listed, but when I'm in a crisis, I'm just going into that like fight or flight mode right there. And I'm using a lot of different behaviors, and I'm getting good at it during the crisis. So the question is, do any of those behaviors, do they rise potentially to the role of competencies? How can I use all these new skill sets that I learned going forward?
Yeah, so stress, burnout, PTSD, those were all huge themes in this study. And what was interesting for us is, and what we really didn't expect, is the level of burnout and PTSD we identified in organizational leaders. We all hear a lot about stress and burnout and PTSD that is so prevalent in first line, frontline staff. And we certainly, the leaders we spoke with, certainly identified that as well. But what we identified is that there was an incredible prevalency of burnout and PTSD in organizational leaders. I spoke with one executive early on in the pandemic when the vaccine was very limited in its supply. And he was in tears as he told me about how he had to tell some of his best friends that they were not eligible for the vaccine at that point in time, knowing that that decision was potentially fatal for his friends. So to answer your question, I think in the moment, we as leaders can be aware of the stress that we are under and take breaks, even short breaks, to recharge. One physician executive I spoke with, he said, you can't give what you don't have, so you need to pay attention to self-care. And so we need to take time as leaders to be and act in an emotionally intelligent manner. We need to take care of and support those around us, but we also need to make sure that we seek support for ourselves. And going forward, the executives that we spoke with identified that resilience training was no longer a nice to have. It was no longer a check the box, but rather it needs to be integrated in all levels of the organizational culture. So not just for frontline staff, but for frontline staff, middle managers, directors, and C-suite executives. Mark, I've given our audience a lot of information. Why don't you let me summarize by highlighting 4 lessons learned and 4 recommendations that came from our study. Could I have the next slide? So, leadership lessons learned. First, emergency preparedness training needs to expand to incorporate chronic scenarios. And stakeholders that we haven't previously included in emergency preparedness, stakeholders such as supply chain management. It's, in my opinion, it's only a matter of time until we get another chronic crises, whether it be a pandemic or a large forest fire near one of our facilities. And we need to expand our paradigm and our vision of what it means to be prepared for a disaster. Second, organizations need to build resilience into the fabric of their culture. Third, the organizations that seem to have weathered this pandemic well were organizations that were already skilled with team building and had strong teams prior to the pandemic. And fourth, in the depths of the pandemic, organizations found themselves with a paucity of leaders, especially physician leaders. Additionally, the leaders that we talked with believed that leadership and talent development was going to be a crucial strategy for staff engagement and retention moving forward. They specifically, interestingly, talked about the need for coaching of leaders at all levels of the organization, including emerging leaders. And they believed that this was a crucial leadership development strategy. Next slide, Mark. So the 4 recommendations that I'd like to highlight that emerged from our study are, first of all, leaders need to become facile in new ways of communicating. The leaders we talked with, again, were recommending additional leadership training, communication training for leaders in all levels within their organization. Second, leadership development strategies need to be intentional and comprehensive. They need to include knowledge acquisition, skills development, progressive responsibility assignments, and coaching. Check the box leadership programs. They're just not going to cut it going forward. Third, as a country, we need to invest in emergency preparedness. A number of the leaders that I talked to laid much of the blame for our early struggles in this pandemic on the fact that we had neglected to develop our emergency preparedness infrastructure over the past 2 decades. And fourth, resiliency and emotional intelligence must be part of the organizational culture going forward, and leaders really need to focus on developing their emotional intelligence. One CEO that I talked with, kind of only half jokingly, suggested that his title, CEO, no longer stood for Chief Executive Officer, but it now stood for Chief Empathy Officer. So those are the 4 leadership lessons and recommendations I'd like to leave our viewers with today.
Dave, that was terrific. I really appreciate how you outlined that in 4 easy take-home points here. Let's move now to the formal questions and answers and ask, again, I'd like to ask the participants to put in any questions they have in the chat. And while I wait for some of those responses to come in, let me ask another question. I enjoyed, there's the slide on emergency preparedness seemed most impactful here. But the question for me is, aren't organizations already doing that? I mean, what is different? What is different now? What do you envision being different going forward?
Yeah, great question, Mark. Thank you. Certainly, hospitals spend significant amounts of time and resources on emergency preparedness, and I don't want to minimize what healthcare organizations did to prepare for, or have done in the past to prepare for emergencies, to prepare for crises. But they need to shift their focus to include chronic scenarios, and they need to change to broaden their perspective to include additional stakeholder groups that haven't traditionally been included in planning, such as I mentioned, supply chain management. Really being ill-prepared for this crisis was in ways inexcusable. We had SARS several years ago that could have well become a pandemic. We had H1N1 that almost became a pandemic. And we really failed to take the lessons learned from those 2 situations and generalize them to be better prepared to face the crisis that we are currently in. And so what I'm advocating is that we don't lose the lessons learned from this pandemic, but we incorporate it into planning for the future.
That makes sense. Makes sense. I saw a slide earlier that talked about building teams, forming teams, and that makes a lot of sense. I get that part. At the same time, I'm reading increasingly in the literature about the shortage of healthcare workers that's going on right now. How does that scenario about building teams work in an environment where there's shortage of talent?
Yeah, thanks for that question, Mark. To neglect team building and team building skills in the face of the current staff shortage is really very short-sighted. We have to learn how to do that in the face of staff shortages. And the reason I say that is because research has shown over and over again that staff that are part of effective teams are more engaged and are less likely to exit their current organizations. So team building is an important long-term strategy to maximize staff retention within the organization and minimize healthcare worker exit from the healthcare industry more globally.
Thank you for that. I know you prepared some take-home slides and points for our viewers. Maybe now's a good time to go over them.
Sure. Thank you, Mark. So At a high level, I think the main take-home message or the main takeaway is that the pandemic has forever changed and will continue to change the leadership competencies that are required of successful leaders. On a more operational level, as we emerge from the pandemic, leaders are going to have to make major investments into their organizations, themselves, and their staff if they're to recover from the trauma of this pandemic and successfully prepare for the next chronic crisis, which will surely come.
Great. That's great. Dave, I like the take-home points. Very straightforward, easy to grasp. And now I think you have a terrific offer that you want to share with our viewers. So let me put that up on the screen.
Thanks, Mark. Yeah, I would welcome the opportunity to talk with any of you about this topic or any other topics of concern to you. To sign up for a free consultation, please just go to my online calendar at calendly.com/David-Dull. Additionally, if you would like a copy of the white paper that resulted from our research project, please email me at david@compassexecutivecoaching.com and include in the title line the word white paper, and I will be happy to send you a copy of that entire white paper.
It really is a good offer. Dave, thanks for sharing with the group. Remember, to our viewers, you can find a link to this recording on our LinkedIn and YouTube pages, Doctor by Doctor Coaching Group. Also, you can follow us on LinkedIn each week for summaries, for polls, articles on interesting topics we believe, and those topics which are brought to us by our viewers to spend more time and energy to talk about and discuss with you. And so please come to our LinkedIn page, ask questions, drop in suggestions, help us plan for future webinars. And speaking of future webinars, it's my pleasure to introduce the next session, which will happen in November 24th, 2021, 5 p.m. Eastern Time. At that point, I'm pleased to say that my colleague, Marike Junkman, will be speaking with us about what is a mastermind group. And that session will be moderated by another Doctor by Doctor coaching colleague, Angela Owens. So again, from the people, Dave and I, who had the pleasure of spending time with you today, as well as the group as a whole, appreciate you joining us, being with us, and we look forward to seeing you next month on our LinkedIn page, on our YouTube page, whatever works for you. Thanks again. Be well.